North Carolina Dems and friends, welcome to the program. I'm Anderson Clayton, chair of the North Carolina Democratic Party, and here's what Democrats are talking about this week. This week, we're talking about Medicaid. Wait, no, don't click away. I know you know what Medicaid is, but this week, what we're talking about is the Medicaid Rebase. You've heard of that, right? Let's get into it. You might not be on Medicaid yourself, but Medicaid matters. Medicaid in North Carolina is health insurance for 1 in every 4 North Carolinians. That's around 3 million people. And it includes children, people with disabilities, seniors in nursing homes, and yes, low-income working folks. Since North Carolina expanded Medicaid eligibility last year, even more folks qualify, like the restaurant worker without job benefits or the small business owner who can't afford private insurance. Medicaid is about more than just the people who are directly enrolled. It's the financial backbone of our healthcare system. The American healthcare industry is motivated by profit. And without Medicaid, there aren't just individuals, but entire communities that aren't profitable enough to be able to serve. Rural hospitals rely on well-funded Medicaid programs to keep their doors open. When Medicaid rates get cut, hospitals lose money. When hospitals lose money, they make it up somewhere else. That means higher costs for people with private insurance and cost-cutting measures that can reduce staffing. Medicaid dollars keep doctors in our towns, keep nursing homes open, and keep mental health services available. When Republicans shortchange Medicaid, they're not just hurting Medicaid patients, they're destabilizing care for all of us. So what's going on? Every year, the state has to do something called a rebase of Medicaid. That's when they update the budget to reflect the actual cost of caring for people. Because costs change, populations change, and the needs change. It's not a surprise, and everyone knows it's coming, and that we have to fund the rebase to keep our standard of care. But this year, Republicans in the General Assembly have underfunded that rebase by hundreds of millions of dollars. Over the summer, North Carolina Republicans passed a stopgap bill, a mini budget, because they couldn't get a real one done, and it left a $319 million shortfall against an $819 million rebase. Plainly, a whole hell of a lot of money is missing. North Carolina's Secretary of Health and Human Services has been sounding the alarms. They've made it clear that spending plan right now is unsustainable and it's going to harm the people of North Carolina. They've said over time, the combination of underfunding, the loss of initiatives, and administrative budget shortfalls risk a fundamental erosion of the North Carolina Medicaid program. That is a crisis of the GOP's own design. They knew that rebasing Medicaid was coming and what it was going to cost them. But here they are, choosing austerity over healthcare. And let's be real, wealthy folks like a lot of these lawmakers and their friends will always be able to find health care. It's the working class families, our neighbors with disabled children, seniors on fixed incomes, and rural communities who will get left behind. That's bad enough by itself. But as per usual, it's got the national Republicans' fingerprints all over it. At the federal level, Republicans have been doubling down on their mission to cut our health care and Social Security benefits. You might have heard of Donald Trump's One Big Beautiful Bill Act, which besides sounding like a 4-year-old named it, is packed with devastating cuts to Medicaid and other programs like food assistance. That's why Senator Chuck Schumer called it the Starve and Die Act. The bill slashes federal Medicaid spending by about $1 trillion over the next decade, which will result in 15 million Americans losing health insurance, including hundreds of thousands right here in North Carolina. Coverage is just one part of it. The bill caps Medicaid spending, meaning growing states like ours will get less money each year to cover more and more people, even as healthcare costs continue to go up. North Carolina's hospitals will see more than $1 billion in new uncompensated care costs over the next 10 years. We already have 6 rural hospitals at risk of closure. This law accelerates the funding crisis and puts even more communities on the brink of losing the only emergency room that they have. Ain't nothing beautiful about that. Of all the Republicans in the United States Senate, just one of them dared to speak out against Donald Trump for cutting Medicaid. Just one dared to vote against the Starve and Die Act.
What do I tell 663,000 people in 2 years or 3 years when President Trump breaks his promise by pushing them off of Medicaid because the funding's not there anymore, guys? Republicans are about to make a mistake on health care and betraying a promise.
That's North Carolina's United States Senator Tom Tillis, who was supposed to be running for re-election next year, but when he didn't vote how Donald Trump wanted him to, he announced he was no longer going to. And you won't believe the guy that Trump picked to replace him.
how much of the big, beautiful bill will be part of the messaging, will be part of the messaging from the RNC?
Well, look, I mean, it is our agenda. This bill is the embodiment of that agenda. Yeah, that's going to be a cornerstone, right? But it's not just everything. We're not just going to take this bill and say, hey, we're done. We're not going to pat ourselves on the back or do a victory lap.
That's Michael Whatley, who was the chair of the Republican National Committee. You know, the leader of the Republican Party, the guy who orchestrated Senate Republicans pulling the rug out from under the American people, now wants us to send him to Washington to represent us. It's real funny, but I'm not laughing. Luckily, our former governor, Roy Cooper, who actually led the charge to expand Medicaid access in North Carolina, is running against him. Thank you, Governor Cooper. In no uncertain terms, healthcare is on the ballot when we vote in our Senate race in 2026. But the fight to fully fund Medicaid here this year isn't over. North Carolina has another chance at getting this right and funding the rebase. Democrats will fight to fully fund the rebase because healthcare is a right, not a privilege. But we're in the minority here. We can't do it all by ourselves. The General Assembly is back in Raleigh for votes this week, and Medicaid is up for discussion. We need Republicans to stand up for Medicaid, so we need you to call your Republican legislators and tell them that you expect them to do the right thing. It's really easy to find your senators and representatives' numbers online. Just go to ncleg.gov/findyourlegislators. Again, that's ncleg.gov/findyourlegislators. When you get there, just type in your address and your state representatives will show up. Click on their names and you'll be sent right to their pages with their office phone number and their emails right on it. Keep your ears to the ground, y'all. This week could be a big one for news coming out of the General Assembly. And as always, there's a lot on the line. Thanks for staying updated with me, and I'll see you next week.